now I will turn it over to Dr. Rick Ingram, who will give you all a brief overview of public health services and systems research.
Thanks, Jay. We're just going to really quickly kind of what the scope of PHSSR is and kind of some key focus areas of the new research agenda that's been developed in conjunction with some of the various funders of PHSSR and the various interest and practice groups that have kind of have a stake in the game, if you will. So to reiterate what Jay had said, PHSSR is defined as a field of study that examines the organization, financing, delivery of services at the local, state, and national levels, and also the impact of these services, these activities on population health. So really we're looking at not just kind of the organization and finance and delivery, really want to see kind of how do these things impact health. You know, why study public health delivery systems? Well, there's really two salient points. First of all, the data doesn't exist. 2003, the IOM report, The Future of the Public's Health in the 21st Century, concluded that, you know, while the IOM committee had hoped to provide specific guidance, elaborating on the types and levels of workforce, infrastructure-related resources, and investments necessary to ensure the availability of services to all the nation's communities, that data does not exist. At best, evidence is limited. And there really is no agenda or support for this type of research, despite what they recognize as being a critical need for such data to promote and protect the nation's health. So really, you know, the IOM recognized that it was a critical area to research, but it hadn't been done yet. And that kind of really helped add impetus to what was already a burgeoning movement to study the public health system. You know, and really I guess the lack of an investment in that initial stage in public health, you know, system delivery is kind of really, I think, illustrated nicely by this you know, fact that for every $100 in federal health research spending, less than $1 is devoted to delivery system research. This really speaks to the need to build the field, and with these mini grants, we really hope to kind of build the foundation from which we can really kind of keep pushing PHSSR along. Yeah, and it really is a burgeoning field. It's getting some traction. This is demonstrated by our next slide. And you know, in the Affordable Care Act 2010, it did allocate money for researching on the optimizing delivery of public health services. If you read under Section B.3, research supported under this section shall include, point 3, identifying the effective strategies for organizing, financing, or delivering public health services in a real-world community settings, including comparing state and local health department structures and systems in terms of effectiveness and cost. So really there was this kind of understanding that there is a need to look at how the system works and how it impacts people. And really, if you look at kind of this next slide, talks about PHSSR and the scientific continuum. You know, we kind of know to some extent what works, intervention research. You know, we know about efficacy. We've got these controlled trials, categorical services, and we have the Guide to Community Preventive Services, which suggests, you know, kind of what works. You know, that's intervention research. We also have, what we've not got so far really is services and systems research. That's what we're moving towards. And this is kind of how to implement what we discover in intervention research into the real world, looking at funding levels and mechanisms, organizational structures, workforce and staffing patterns, information communications infrastructure, law and policy, how it all works with healthcare, how do we get to at-risk populations, you know, what are the quality and effectiveness of different policies and different procedures, you know, cost efficiency, return on investment, how do these systems and services kind of activities impact equity or disparities, and again, how does it impact population health in the end? So in order to kind of better focus our efforts to promote PHSSR, we convened with a whole bunch of our funders and kind of our advocacy groups and other folks. Some attempts to create a new research agenda for PHSSR. We kind of looked at the one that was created by Lenaway and some other folks in 2000, I think, maybe 4 or 5 it was, as well as the PHF research agenda, and kind of wanted to revisit those and see, which points were still relevant, which points weren't, and kind of what did the practice community really think we needed to look at. And we looked at 4 focus areas. The first focus area is workforce, and kind of some of the really, I think, salient questions we found in workforce were, what is the current composition of the workforce? There's still some question as to what the proper way to define the public health workforce is. Then there's a question of what are some optimal staffing patterns. What is the optimal kind of nurse to, let's say, nurse per capita ratio to make sure that nursing services are provided adequately and properly. How can the public health system agencies improve recruitment, retention, and training of their employees? How can we maintain workforce capacity? As I think a lot of you are probably familiar with, there is kind of this, to some extent, looming problem of a public health workforce shortage. People are going to get older and retire. How do we kind of maintain that capacity in the face of these demographic changes we're undergoing in the workforce? And how will credentialing impact public health? Those are kind of our workforce focus areas, or some of the salient points, rather. Focus area number 2 was structure and organization of the public health system and agencies. One of the key questions is, what is the best organizational structure for efficient service delivery? And not just efficient service delivery, also effective service delivery. Another one is, how does regionalization affect health outcomes? There is some movement in the public health field to having agencies perhaps share services or have memorandums of understanding where an agency that doesn't provide a service can have another agency who's in a close proximity to provide that service, and kind of they would enter into a joint agreement that that service would be provided or be available to rather the populace that the agency that doesn't provide it serves. So how does that affect health outcomes? Is that an effective strategy to serve the public? How do we build meaningful collaborations for service delivery and positive health outcomes? This could be collaborations with other agencies or other system partners, nonprofit agencies, hospitals, places like that. And then how do the organizational characteristics of health agencies affect their choices in an adverse economic climate? Currently, you hear the common term feast and famine. Currently, public health is in a state of famine. With obvious economic crises, we've got some both present and looming budget cuts to public health, and how do the characteristics of health agencies affect their choices on how they impact that, and also how do these choices impact public health? Those are some real salient areas. Focus area 3 is financing. And financing really is kind of one of those areas of public health where we really realize there's not a lot of good data there. One question is, how can we best capture finance data? We still don't really have, I think, an adequate mechanism to really capture, to a very granular degree, finance data. Some of that's due to there's a lot of variation in how public health activities are financed between states and localities. That contributes to it. Another question, what is the impact of financial and economic characteristics of health agencies on health outcomes? How does variation impact population health? How does legal infrastructure influence public health agency financial status? And are there benefits from financial data harmonization through practice organizations? Those are some kind of salient questions. But really, our last area of focus is technology, data, and methods. One, I think, key question is, can health information technology positively impact health status? Another question that we've seen come up again and again is, how can we improve the capacity to collect and analyze data related to public health and the public health system? And really a key question in order to use data to actually inform policy and really improve public health is, how can we better translate the data we have to really influence, or to make it usable for policymakers to let them influence policy. And then, what data collection and use practices best support looking at how it impacts health outcomes? Those are kind of some key questions there.